Hey everyone, Dr. Gary here. So this video is going to be on Jamie Foxx and his hair transplants. We are going to add up the approximate cost of his surgeries at the end of this video, so make sure to stay tuned to that. And also, we have these new hoodies now. They're all about body positivity. Our I Feel Beautiful hoodies are out, so make sure to please check that out too. Partial proceeds do go to the Alopecia Areata Foundation. So let's get into this. Jamie Foxx, who I love as an actor. I mean, he is just phenomenal. Really appreciate all of his work and his talent. So 1994, at the age of 27, if you look at his hair here, he has a nice clean line. You can see the mature height of his hairline, and notice the location of his temporal points, right? So that's like the temple as you're bringing it up from the sideburns up to this frontotemporal peak. There's an anterior projection to the temple, and then it curves back into the frontotemporal area. So notice where that point is relative to his lateral eyebrow. This becomes relevant later in the video. Guys, smash that subscribe button if you aren't subscribed already. Turn on your notifications and like the video. Thank you. 1997, age 30. I don't see too much of a change here in Jamie Foxx's hair, so we're gonna keep going. 1999, age 32. So in the photo on the right, it looks like maybe he has some camouflage, or camo, we call it for short, in his hair. So this could be like a keratin fiber or some kind of makeup, less likely a hair piece. He's using it to kind of bring in the temples and to help frame his face. And in 1999 was also his breakthrough acting role in Any Given Sunday. Year 2000, Jamie Foxx is now 33 years old, and it looks like he's starting to experiment with the height of the temple area a little bit. They were a little shorter, now that temple is a little bit longer, and he's definitely using some kind of camo, again maybe a hair system here, to shift that hairline height. 2001, age 34, not much has changed. Same thing here in 2002 other than the hairstyle. 2003, I again don't see too much of a change. 2004, this is where something has changed, right? Age 37, the hairline looks lower. It looks like he has a narrower forehead, and observe how the temples have been brought in. Okay, so it's now much closer in a vertical line to that lateral eyebrow compared to how he was when he was 27, right? You see that difference. And I did analyze some images from the movie Collateral, and I don't really see any obvious signs of an FUT scar, and it was definitely too early at that time in 2004 for FUE. FUE was only popularized around 2010 and later. You know, could he have had his transplant by now? Maybe. You know, we know that Hollywood does a good job of covering up scars, and so it's possible. Either some camo, a hair system, or this might be the first sign of his FUT hair transplant procedure, because as you see in the next few years, it looks like there's stability of that new type of look that he has. So unclear if it was really at that age, 37, but it's possible that that was his first hair transplant. 2005, age 38, the hairstyle looks very similar to the year before. 2006, again, looks very similar, and you can clearly see the demarcation line of where the natural hair ends, and either there's some camo or a system or something there in its place, or possibly this could be transplanted hairs and you're just noticing the disparity because of the spacing between the transplanted hairs compared to his natural hair density. And again, I looked at some pictures from Miami Vice in 2006. I don't really see any obvious signs of an FUT scar at this point. But then in 2007, at age 40, we know that there's already an FUT scar. So the question is, at what point did he actually get the transplant? My guess is still in 2004. So in 2007, now age 40, he came out and said this because there's a big tattoo on the back of his head that for his 40th birthday, he got this tattoo to, I don't know, it's a tribal type of sign. I'm not exactly sure what the reason it was that he gave, but either way, it was very clearly used as a way to try to cover up that FUT scar. Again, if you look at this profile shot at age 40, there's this clear demarcation of the transplanted zone compared to the non-transplanted zone behind it. And likely he had about 2,000 grafts with this strip surgery. 2007, again, you can see this scar that is being covered partially by the tattoo. In proper lighting, you can really see that scar there. It's very clearly, to me, an FUT scar. 2008, age 41, again, really try to see that demarcation, that difference between where the natural hairline ends kind of up here and when this newly transplanted hair, begins. And you can really see that difference, and you can see that difference in the density as well. And it's important here to point out that transplanted hair rarely matches the natural density of the person's original hair. We try to come close, but sometimes additional procedures are necessary to increase that density. And the reason is this, because if we're transplanting in an area that has pre-existing hair, you'll often have to work around those pre-existing hairs. So now you're transplanting in between. If the person was not on any medical therapy and was to lose that original hair, now you have gaps visible. And if you're working on an area that has no hair left and you're doing a transplant, you have to be careful with the type of density that you create, because if you go too high in the density and the hairs are placed too tight, you can actually compromise blood supply and have issues with the regrowth of the hair, and you can even destroy the area of the skin and cause necrosis, where an area actually dies off because you've now punctured through all the blood supply of that zone of the scalp. So you have to keep it safe, and it's better to do multiple procedures spaced out where you're slowly increasing the density rather than doing some heroic type of surgery and potentially causing major problems and then running out of options on how to repair that. And that is a bit of a tangent, but I think it's important to point out. And in the picture on the right, I think he's had some camo added here to better blend his transplanted hair with the natural hairs, the original hairs. 2009, age 42. He seems to have the same sort of narrow and relatively high hairline. 2010, age 43, unchanged. 2011, 2012, and 13, not much, in my opinion, has changed. However, in 2014, at the age of 47, I do see a major change. A lot more natural. The hair, to me, is looking a lot more natural. Some would argue for his age, his hair is too low, but I think that overall, compared to what he had prior, this is a much more natural look. And the main reason to me why that is that the frontotemporal peaks are now lateral, more to the side of his lateral eyebrow. And that is more of what he looked like when he was much younger. And in general, it's a more natural type of look. And the hairline is again noticeably lower with really excellent framing of his face. So likely, I think he had an FUE procedure here of about 1,500 to 2,000 grafts, and he may have had electrolysis, laser hair removal, to lateralize those temples. There's a picture later I'll show you where I think I see some signs of that. So the FUE scars also, I think, are a bit more visible on an upcoming photo. Again, it's a bit speculative here, but that's what I think most likely happened. 2015, not much of a change. 2016, unchanged, but he's continued to use camouflage, keratin fibers, whatever it might be, for the blending of the transplanted hair to the original hair. 2017 and 2018, not much has changed. 2019, I want you guys to pay attention to, on this picture on the right, that lateral segment right next to his temporal point, that inch in front of it of where he had his original hairline prior. I think as they've done that laser hair removal and lateralized that temporal point, there's been some hypopigmentation or loss of pigment in that area, and that's something that could happen during laser hair removal. I think you might be seeing signs of it here. 2020 and 2021, not much has changed. And this other important point here, I wanted to bring up this picture from Project Power, which is a Netflix movie in 2020. And I think it's interesting here because not only can you see the FUT scar, you also, if you look closely and use a little bit of imagination, I see some signs of FUE work too. These little circular scars throughout the back of the scalp, and it looks like he's gotten rid of his tattoo. Go figure. So to summarize, Jamie Foxx, I believe, has had 2 hair transplants over the course of the last 20 years. And the first one was FUT, 2,000 grafts approximately. This was back in like 2004, I think. The second surgery was FUE, about 2,000 grafts in 2014, so 10 years later. The first surgery, my guess is cost him about $10,000. Second surgery was probably closer to $20,000, which brings us to a grand total of about $30,000 to have this type of hair restoration. And that doesn't include, of course, all the different hairstyles and the camouflage and any maybe hair system that he wore at some point. So let me know what you guys think in the comments below. Do you think I'm right? Do you have some other thoughts on Jamie Foxx's hair transplant work? Please make sure to check out our Body Positive I Feel Beautiful hoodies, our first merchandise, and partial proceeds go to the Alopecia Areata Foundation, which is the condition that I have, as many of you know. I'm wearing this today because I'm actually doing a hair transplant today, hence the surgical cap. That pretty much sums it up, and hopefully you enjoyed this talk on Jamie Foxx's hair transplants. If you enjoyed this video, please make sure to check out our hair analysis on LeBron James. Click on the card